We have with us Dr. K.R. Vasudevan, Senior. Please welcome Dr. K.R. Vasudevan, Senior Consultant and Head Liver Transplant from Max Noida. Can we have a round of applause for Dr. K.R. Vasudevan? We also have with us Padma Bhushan Dr. S.K. Sareen, Senior Professor, Department of Hepatology and Director, Institute of Liver and Biliary Sciences, New Delhi. He'll be joining us virtually. I now invite and welcome on stage Padma Shri Dr. Sanjeev Bagai, Senior Consultant and Chairman, Pediatrician, Nephron Clinic. Can we have a more energetic round of applause for Dr. Bagai? A very warm welcome to you, sir. We also have with us Padma Shri Dr. Sumitra Rawat, Chairman and Head Department of Surgical Gastroenterology and Liver Transplant, Sir Gangaram Hospital, Delhi. A very warm welcome to you, sir. Dr. D. Bhaumik, Professor and Head Department of Nephrology, AIMS, Ministry of Health and Family Welfare, Government of India. A hearty welcome to you, sir. And I now hand over the session to Dr. K.R. Vasudevan for further proceedings.
We have, is Dr. Sareen online?
Yeah, he'll join. He'll just join us.
He'll join. Okay, so welcome to this session. A lot of toxins are formed within the body, and we also ingest and breathe a lot of toxins. So the body needs to have a mechanism to cleanse the body of all the toxins. And the two primary organs in this are the liver and the kidney. So today we have a panel of learned gentlemen to answer, first to present to us how they play a role and emphasize on points that they would like us to know, and then address any concerns that you may have regarding the cleansing of the cleansers, how to keep the liver and the kidney healthy. Would like to start with Dr. Bagai. He's a pediatric nephrologist. Would like to start on how we keep the kidneys healthy in children.
Good afternoon, everyone. So, the kidneys of adults actually are formed in utero. So, I'm going to begin my very brief story of a healthy pregnancy. A well-nourished pregnant lady is going to give birth to a normal, healthy newborn she then develops into a normal, healthy child with good kidney function, and then a good kidney function in adolescence, and then in young adults and going on. 1 to 2% of pregnancies have some sort of structural abnormalities. Almost 99% of these structural abnormalities in the kidneys are treatable immediately after birth, and these days sometimes even in utero. The difficulty arises in a very vast country like India, where the scattering of healthcare is often sporadic, is that these illnesses sometimes are not diagnosed by ultrasound antenatally. 30% of undiagnosed kids land up in chronic kidney disease programs later on in young adult life or even in adolescence. So the first point is an antenatal good care, postnatal good care. A lot of these children in young age group, especially infants less than 1 year, very often they have occasional fevers. It's very often labeled by parents as viral, and very often they are even treated without investigations, because in India everyone is born with a doctor's degree without a qualification. So they are given antibiotics at home, and then the infection, which is the commonest infection in children, is a urinary tract infection, gets suppressed but not treated, not eradicated. 40% of undiagnosed, untreated complex UTIs in children again go into chronic kidney disease. So the second point is to pick up infections in the kidney at an early stage. Children's warning signs are very subtle. They are very hidden. If a child comes with headache, please check the blood pressure of a child. We have specific cuff sizes available. Ensure all children at least once a year have a routine blood pressure check. Point number 2, growth parameters need to be charted and monitored. One amongst the first signs where children's kidneys are not doing very well is they fall off the growth charts. That's height and weight. If children come with headache, if they come with fatigue, if they come with growth failure, look out for kidney. Abdominal pain, swelling in the limbs, again, early markers of kidney disease. In terms of preventive measures, if I can complete my segment right now itself, is a message to all people of all age groups. Either we have kids or we are parents. Look out for the bad S's. Keep your children away from the bad S's. Too much of salt, too much of sugar, too much of spirit, which is alcohol, too much of sedentary lifestyle, and most importantly, smoking. These 5 S's are going to damage almost every body organ, including the kidney. In terms of pediatric vaccines, a lot has been done. Hepatitis A, hepatitis B vaccines, and many others, which my colleagues will enumerate, have largely prevented a lot of organ disease. Again, a last message before I end this segment is, medication should be used with caution. Sometimes not using a medicine irrationally at home is better than to use a medication which is being abused. Irrational use of antibiotics damage infants' kidneys. Combination painkillers which contain more than 1 or 2 what we call as NSAIDs, pain medicine, anti-inflammatory medicines, are not good for infant kidneys. Herbal medicines definitely not good for pediatric kidneys. Alternative medicines not good. Especially during dengue season, we've seen a lot of parents giving papaya rus and loki leaves and so on. It damages the kidney. And lastly, beware of pollution. It damages the kidney and liver and many other organs. And beware of plastics. These are the 2 carry-home messages. Look after the children. Pregnancies need to be looked after if we want a healthy India. Thank you.
So, Dr. Bagai, is keeping the kidney healthy an act of commission? That means you got to do something, or is it precautions like acts of omission? Take care or not to do these kind of things. And second, in your practice, what are the most common problems that you see which are preventable related to the kidney in the pediatric population?
Yeah, I think early diagnosis of hypertension in children, the common question parents ask is, "Mere bachche ko BP hai?" Every child has a blood pressure. The question is your blood pressure on the higher range, which calls as hypertension? No human being can exist without a blood pressure. But hypertension in pregnancy and in young children, infants, needs to be monitored. Very often I've seen pediatricians clinics, GPs clinics, not even have the pediatric cuffs. That's being criminal. The second point is to avoid toxins to the kidney. Like I said, too much of salt, sugar, spirit. A huge amount of adolescents are indulging in alcohol abuse. It's not good. I mean, 20 minutes after consuming of alcohol, acute inflammation, and within a couple of weeks, chronic inflammation sets in almost every part of the body. But look at the growth, look at good healthy diet. Too much of trans foods, ultra-processed foods are not good. What we call as too much of McDonald's and too much of Coke, Pepsi is definitely not good. It's largely preventable, and we need to be aware.
Okay. So I am told Dr. Sareen has joined virtually. Can we have him on the screen? There it is. So maybe, sir, we would like you to address the audience on what we can do to keep the liver healthy. Floor is all yours.
Thank you. Apologies for being slightly late, and it's nice to see you, Dr. Austin. And you know it equally well, he is a liver transplant person, and so is Sumitra. So keeping liver healthy is a very big question. It's like Dr. Bagai said, it is related to the whole of started in the school. Previously, we used to think that if you are drinking for 10, 15 years, then you probably end up with liver disease in 10-20%. But today, we have young people, another floor, we have a patient who is probably 23-year-old. He is also referred for a transplant. This never used to happen. So, the lady from Northeast, she is also for transplant, young lady. So, the trend of having young people coming for transplant or advanced liver disease due to alcohol is something people have to understand. Part 2 of this is that if your parents or yourself are obese or have diabetes or blood pressure, the small amount of alcohol for short duration can be extremely harmful. So to keep liver healthy, avoid extra weight. Keep height minus 100 as a simple formula for men, so height minus 105 for women, and your weight is let's say 80 for a woman, and for a man let's say 90 centimeters, and avoid alcohol. The third, to keep liver safe or healthy, is no drugs. You do not actually know where the drug is. You think it has gone into your mouth, but the drug actually goes from mouth into the intestine, gets goes to the liver. Every single drug is utilized by liver and kidneys excretion. So avoid unnecessary usage of painkillers, antibiotics, unless doctor is strongly writes to you to take it. One more thing is that for liver health, simple blood test called AST, ALT or ALT alone or SGPT alone is good enough. So everyone sitting and hearing this SOCM wellness thing, you should know that you know your hemoglobin. It should be 13, 14, 15. Similarly, for liver health, your SGPT or ALT test should be preferably less than 30. Please get it associated with our free LFT service. If not, we will do that for you. SOCM, I hope you will support everybody's liver function. Thank you, Dr. Vasudev.
Sir, I want to re-emphasize, keeping liver healthy, sir mentioned primarily, don't do this, don't do this, don't do this. There was not a single point which said, do this. Maybe that would have been exercise. It's a little bitter. But other than that, it was all, don't do, don't do, don't do. And he also mentioned a couple of patients who are now, the liver has damaged so much that it needs a replacement, and very early in age. So, sir, question to you is, if I have started to damage my liver because I am overweight or I have alcohol, and then I want to withdraw that. So when can my liver recover? What is your message towards people who have started on the wrong path but now repent? Okay, I understand that I can't do anything positive. I can't do an act of commission to keep my liver healthy other than exercise. Okay, I've done some things wrong and now I want to change my path. Can my liver be salvaged?
Thank you, and thank you for supplementing the exercise part. Let me give 1 minute or 2 minutes for the relevance of exercise. Once you take sugar in any form, let's say ice cream, the sugar goes to 2 places. One is to the muscle and one it goes to the liver. If your muscles are inactive, you are sitting, all the sugar will go into the liver. And liver will say, oh, too much of calories. It will convert those calories of carbohydrate, sugar, into fat. And that's how the fat will get deposited in the liver. But the moment you start exercising, the calories which are extra will not go to liver, no fat deposition, and the calories are burned in the muscle. Number 2, if you are fat and you can exercise, which you should, the fat from the liver can be diverted, especially during time-restricted eating. Don't eat throughout the day or not late at night. The second part is, you are asking an important question, can I reverse my liver injury? Yes. Those who have hepatitis B or C, if they are treated, the scars of the liver, even cirrhosis, is less. But the risk of cancer For alcohol, for sure, if you have the patient and he has not developed this jaundice or liver failure, stopping alcohol is the most significant way of recovery. And many people recover, but don't allow liver to be insulted to the lung. The recovery takes few years by remodeling, and liver can regenerate. In fact, exercise releases several myokines, muscle messaging substances which make liver regenerate. So all cirrhosis or liver patients, they stop frequent exercise and that will regenerate the liver. And the third part is if the person is overweight, he loses weight, he is diabetic, he has hypertension, he has high cholesterol and thyroid. We see every day, either you do bariatric surgery, if it is feasible, patient is fit, all these can reverse slowly, 80-90%. Part 2 is if you can lose weight by your willpower and exercise, nothing like it, you can earn your health. I would like to warn clearly that please do not use weight losing drugs unless it is absolutely essential. You are unable to do, because now there is a huge market every day. You see something new coming in the newspapers. I am not against them, but they are substitute or they are relevant to people who don't want to move, who cannot move or have decided I want to get well without moving even a cent. So please, they are not meant for you. They have their side effects.
Thank you, sir. Thank you very much. Any questions to sir from the floor? Then we can free sir to carry on with his clinical duties. Yes, please. Yeah, go ahead. I'll convey that.
Yeah. Sir, besides this reducing weight and avoiding alcohol and certain painkiller medicine, is there any specific diagnosis for liver reversing?
So her question is, you mentioned what we can do, but how do we know is our liver healthy or not? What tests should be done? And as an extension, what should be the starting age we do and how frequently we should repeat it? There's a fad of general health checkups and teenagers are coming for general health checkups.
So the health checkup should start soon after the birth. I think the mother is fair not to make the child overweight, and if the child is born overweight, 19% of the babies now are born between 3.5 to 10 kg, which is unhealthy. So it should be clear that the babies right from birth are kept like normal weight. The age for health checkup should start from house. Every year the child must know that yes, I have to be healthy, not when he has become 12 years old. Wait for that. Part 2 is if the liver has, there are two parts, one is inflammation and one is scarring in the liver. Inflammation is measured, as I said, by SGPT or ALT, which will less than 30. Yes, if it is 80, 100, you are unhealthy. It's the liver on fire. It must be investigated and fat or alcohol or other drugs themselves be avoided. Second part is fibrosis. The inflammation is healed or contained by formation of a scar, by which fibrosis is hardness, like a scar on your skin after burn. Is it stage 1 scar, 2, 3 or 4? So if there is a stage 1, we call it cirrhosis. This is ultrasound by a stiffness measurement by something like fibrosis. Always worrisome, and alcohol, it is also worrisome. So my suggestion is, and third is, anybody who has a cholesterol or triglycerides, probably has fat in the liver. Almost all that have probably 80% have fat in the liver. And people around. Today, 39% of liver cancers in India are come at habit for above over stiffness or scarring done. They routines go to the stage of full cirrhosis, but will develop stiffness, liver inflammation, and complications of stiffness like liver cancer must always carefully assessed. Liver is a steady organ. It doesn't make a noise, but sometimes it can slow someone taken care of.
Thank you, sir. So if I can summarize what sir said, it's easy to check for the liver health by a set of blood tests and tests which are done by radiology like ultrasound and fibroscan. And in sir's opinion, it should start practically after birth, at least height, weight, measurements, and few basic tests, not, if not the entire extensive tests that, you walk into a hospital and say, health check. It's a lot of tests. You may not need that every year, especially in the young age. And secondly, as you grow older, if your liver is damaged, you probably need it more frequently. If your liver is not damaged, you probably don't need it more frequently. Thank you, sir. If there's one take-home message which you would like to give, then we can move on to the other panelists.
Well, my take-home message is that liver is core to all non-communicable diseases. Be it diabetes, which we think is a liver disease, be it kidney disease, be it blood pressure, or it is coronary artery disease. To keep liver healthy and percentage of fat should be less than 5%. It will keep your sugar and your weight under control. And message is, keep your liver healthy to live long and healthy.
Thank you very much. I would now call upon Dr. Bhaumik. Dr. Bhaumik is the chairman and head of department of nephrology at AIIMS. And sir can help us understand what are the early signs of kidney damage and how do we keep our kidneys healthy. Sir, please.
Thank you. Thank you, Dr. Vasudevan. First, I will thank and congratulate ASSOCHAM for this wonderful wellness to illness seminar that they are holding, and for organizing and bringing us together on this platform so that we can convey a few messages to you. Dr. Bagai has already spoken to you. He's given crisply many messages. I'll just put some things in a little bit of a perspective. That first one is to understand that what is the kidney? We have two kidneys, we are all aware. Although there's only one liver, we have two kidneys. And these two kidneys have multiple filtration units, which in medical parlance is called as the nephron. So these filtration units basically has filters, simple filters, because it's a detoxifying organ, as we heard. And then there's a microtubule, which finally join up and drain the urine into the bladder. So I hope you are aware, or I'll tell you that how many such units we have. We have 1 million or 10 lakh such units on each side. That's a big number, isn't it? But unfortunately, things can go wrong. In fact, we Asians are already destined to have a little lesser number. We may be born with just 7 or 8. So as a race, we are already, on the adverse side. Secondly, as Dr. Bagai so rightly mentioned, a healthy mother is very much required, because if the mother is not well nourished during pregnancy, then the chances of child being born with lesser number of filtration units becomes much higher. So if the child is underweight, has got growth retardation, or is born too early, because this growth is completed by 36 weeks, then you'll have lesser nephrons. So anyone who has lesser filtration units by birth becomes at risk for kidney disease. That is something very important to remember. So we have to preserve these nephron numbers. Now coming to, how the kidney disease presents. Before that, one has to understand the kidney is not only a detoxifier. We are all aware of this here in this hall, but the kidney has got 3 other very important functions which we often overlook, and that has a bearing on the symptoms with which the patient comes. So the first important thing is that the kidney regulates BP. Everyone thinks that the heart regulates BP. No, heart does not regulate BP. Heart is a pump which functions as per the directions given by the kidney, because the kidney has a hormone which is called as a renin, which regulates BP. And if there's something wrong in that, there'll be a problem. That's why, as sir mentioned so well, that patient comes with headache, please check his BP, because then hypertension is a very important cause and an effect of kidney disease. So hypertension is very closely related to kidney. Please, this is the first very important message. Besides that, the kidney is very important in regulating our hemoglobin, or the redness of our body. So hemoglobin is formed in the marrow, but again on the direction of the kidney, a hormone from there. So if the kidney is diseased, you will have anemia. So you understand that it's all related. So hypertension and anemia are two very important symptoms of chronic kidney disease. And thirdly, the other important hormone is the hormone which activates the vitamin D which we all take now. You know, it's a fad now that everyone takes vitamin D every week almost or every month. But that vitamin D is useless unless the kidney is able to activate it. So if the kidney doesn't activate, then you'll have bone disease. And that, if that happens in children, then they have rickets. In adults, we have something called as the renal osteodystrophy. So please remember, kidney is a detoxifier. It maintains the acid-base balance of the body. It maintains and regulates the blood pressure, maintains our hemoglobin, and maintains bone health. So from this now we can understand that how the kidney disease presents. Now please remember that kidney disease can present in basically two ways. It can be an acute insult to the kidney, which will happen if a patient has got diarrhea, vomiting, some severe infection. Then it is an acute kidney disease, which is reversible if treated in time. So it has to be diagnosed and treated in time. So that is called as the acute kidney injury. Other is the insidious disease called as the chronic kidney disease. Now that may or may not have any signs in the first few months or years. And that's where the preventive checkups come in, that you must check, as we talked about the liver, for the kidney. There are two very simple tests. One is that, apart from BP of course, is that one must check the urine for any protein leak. As I said, we have filters, so if the filter is damaged, then protein from the blood will come out into the urine. So you check for protein, which is a very simple test. It can be done with a stick at home as well. And second is the urea and creatinine. So I think if you understand this concept of acute and chronic, then things becomes easy. If acute is not treated in time, it becomes chronic. Or you can have a chronic which starts and goes on insidiously. And third important thing is we have is the urinary tract infections, which is also a very important presentation of kidney disease. So I think if one has these bearings in mind, it becomes very easier to understand how the kidney functions and how we can protect it. Coming chronic kidney disease, which is the most important thing, please remember just two diseases which are very important, which is again related to the liver. One is hypertension, which is a cause and effect. So if patient is hypertensive for many years, his filters will get damaged, and that accounts for 25% of all CKDs. And second, or rather it's the first actually, is diabetes, which actually accounts for 40% of all CKDs. So all diabetics must check not only their sugar, but their BP and for protein leak in the urine. If you check this much, I think kidney health will be well protected. Thank you.
Can we do something to keep the kidney healthy?
Yes,
is that
yes,
something
of
active vis-a-vis, is it just like the liver where don't do this, don't do this, don't do this?
Yes, so
Or
for the kidney, yes, we can do, yes, we should do. First, which is common, is that you maintain your weight, exercise, be fit and healthy, maintain the same BMI standards which were talked about, your weight as well as, more important than weight now is the waist-hip ratio. Dr. Sareen mentioned that 80 centimeters for females and 90 for males, and then you have the ratio as well, so that it has to be maintained. That is more important because what is really bad is the fat accumulation in the abdomen. So in the liver and in the abdomen, that harms most. So more than the weight, we are more concerned with the fat deposition there. So being healthy and exercising is the most important thing. Drink enough water. Now the thing is, how much water should you drink? That actually it is much simple. It's not that you have to drink 2 liters or 3 liters or 4 liters. It is the other way around. What is important is your urine output in any season should be 2 liters. So you drink that much water, which will produce 2 liters of urine per day. In simple terms, urine should be clear. If urine is concentrated, that means more yellowish, then there is a problem. In fact, I was told in some 5-star hotels now, in the urinals, they have something which picks up that the urine is concentrated and tells you that you have to drink more water. So drink enough water. So in summers, obviously, you have to drink more water to maintain 2 liters. No smoking. That has already been told. No smoking. If you are a diabetic or a hypertensive, you have to be extremely cautious. You have to check your urine every 6 months to 1 year, check your blood test so that you can pick up kidney disease early, because now there's so many drugs which can reverse kidney disease if it is picked up early. So I think if one follows these few simple things, I think you can definitely protect your kidney health. So smoking is an absolute no-no. Alcohol is very important for the body as a whole, and there's so many problems. It doesn't have a direct bearing on the kidney, but then of course, to would have. Obesity is the most important thing. See, obesity harms the kidney in two ways. One, it can cause diabetes, and the diabetes will harm the kidney. As I said, diabetes accounts for almost 40% of all our CKDs. And second, obesity itself directly harms the filters and causes loss of proteins. So obesity is extremely bad. It's very important, which one must remember.
Sir, if I take a poll right now on how good the panelists are, how good they are, we'll probably all be in the bad category. Everyone's saying exercise, everyone's saying don't drink alcohol, keep your weight. कोई भी अच्छी चीज़ नहीं बता रहा है. No one is saying take this medicine and you're going to be fine. Everyone came, I came for that.
In fact, medicines, as already been mentioned, one must reduce the over-the-counter medicines to a bare minimum. Dr. Bagai has already mentioned all that, because everyone has toothache at some point of time, muscle ache, so one does take some paracetamol now and then, even takes an NSAID once in a while. But one must limit it to the bare minimum and get the root cause treated so one doesn't have to take these painkillers for too long. He's already talked about Howell medicines and other things. No, because the kidney has to bear the brunt ultimately. If you take too many medicines, it will either go out through your liver or through your kidney or harm either or both.
So one last question to both the kidney panelists. And we have SOCHM over here. If you have to recommend or make a small plan to keep everyone in the industry healthy and send a message, we're clear that some blood tests or some urine tests, simple tests and a BP, taking a BP, will be helpful if it's done periodically. Now, what sort of tests can and should be done to the employees as well as Sir can add to the children at home, and how frequently they should be done? What should SOCHM take home as a message and try and work on?
After you.
It's already been mentioned that what we want as a nephrologist is that BP checkup is very important, yearly for everyone at the bare minimum. For hypertensives, that would be more frequent. If you're diabetic, more so. Check the urine regularly. You see, diabetics now, most diabetics would have these sticks with which they monitor the your urine sugars. That same strip also has another pad on it, which is yellow colored, which changes color if the patient has protein leak. So then that should be checked immediately. And now you have a simple laboratory test called as the protein creatinine ratio. So you don't have to collect 24 hours of urine. You have to just give a morning sample and you can check how much protein you're leaking into the urine. And that is a very, very early sign of kidney disease. So BP checkup, urine checkup, and then a blood test maybe once a year from our perspective, urea creatinine, and I would say hemoglobin as well, because as I said, picking up anemia early is also very important. So these 2-3 very simple things will go a long way in
once a year?
Preventing.
Once a year?
For at least for the hypertensives and diabetics, and for the general public, I think already SOCHM does all these annual health checkups. Please include the urine albumin creatinine or the protein creatinine ratio in that, because that picks up kidney disease very, very early. One must include, apart from this whole battery of tests, simple urine routine microscopy as well as the urine protein creatinine ratio. So that would be my advice, plea actually, to the SOCHM. Vaccination, sir mentioned about hepatitis B. I'll just complete the statement here that in adults, when we vaccinate our chronic kidney disease patients, CKD patients, they have a lesser immune response. They don't respond that well. So the normal protocol is to give 3 doses. In our case, it is 4 doses over 6 months, double the dose each time. Even then we fail in almost 20 or 30% cases to incite appropriate response, the antibody response. So they require more vaccines, and we also advise pneumococcal vaccines to our patients because they're more prone for infections.
So at least once a year in children, blood pressure monitoring should be made mandatory. Growth charting, especially for in the growing child under the age of 5, should be done 2 to 3 times in a year. As far as the overall child is concerned, we ask for good life and then we don't look after lifestyle. So I think sports and exercise should have a great focus in the school arena, in the colleges. Health and good nutrition, good weight should be incentivized. I think those need more marks rather than calculus and English languages. So I think overall we need to relook at to what next generation we want and how we want our children to grow up as. So we need to look after our nutrition, our diet, less of fried and excess ultra-processed food. And please, for heaven's sake, if there is one message I want everyone to get from here is encourage children to play sports, let them enjoy as much as possible outside in the playgrounds. It will help them a great deal.
Thank you, sir. We're running a bit late, but I would like Dr. Rawat. He is a surgeon, and he sees all the damage we do to the liver in all shades. He is the head of surgical gastroenterology and liver transplant at Sir Gangaram Hospital. I'd like to request him to be a little brief and add on to what we can do to keep our liver healthy.
I think Dr. Sareen has already mentioned that simple lifestyle, which I think this generation is forgetting. I think alcohol, very important. And if you can't avoid it, you know, have it in moderation. Excess of everything is bad. Have your weight steady. Don't become overweight or obese. I think for the new generation, important thing is, as a parents, we need to tell them, don't engage in a risky behavior. I think Dr. Sareen talked about illicit drug use, which is very important. And other one which I will add is unprotected sex with multiple partners. Because when you look at cirrhosis or a liver failure, 80% cause is alcohol, hepatitis B, hepatitis C. So when you look into it, avoid alcohol, or if you are having, have it in moderation. As Dr. Sareen has said, maintain your weight, regular exercises, plenty of fruits and vegetables, avoid fatty food, avoid processed food. This is what one should do. And this is about protecting the detoxifier, and for both kidney and liver, be adequately hydration. Have plenty of water, good food, exercise, alcohol, and don't have risky behavior. This will take you a long way. And like Dr. Sareen mentioned, we are also seeing a lot of young patients coming for the transplant, and quite a lot of young patients where they are getting GI and HPV cancer early. So unless and until we go to the old way, where my granny, my grandmother, grandfather, they used to teach us home-cooked food is the best, plenty of vegetables, a lot of fruits, avoid outside food, which is fat-ridden, and also processed food, which is very, very important and is carcinogen.
I think a number of people must be thinking, oh, we've got 3 or 4 more grandmothers and grandfathers advising us. Pehle se jo the wo kafi nahi the. But I guess that's what it is, to summarize, to keep the liver and the kidney healthy. Those are the organs which keep the body healthy. There's not much we can do actively. It's a lot more things not to do than to do. So if there's one message that, as a moderator, I can give to you, there's not going to be one medicine or one pudiya or one supplement which can jadui karke magically improve the health of the liver or kidney. It's a lot of things not to do or do in moderation, and only one thing which you need to do is keep your body healthy, which essentially means activity and exercise.
I will add a couple of things to do. Good hydration, lot of exercise, make sure that you spend half an hour to 45 minutes looking after yourselves. You are looking after the world as a top of the industries, as a doctors, we are looking after the patient. Give half an hour to 45 minutes to your own self. Good hydration, good sleep, plenty of fruit and vegetables, avoid fatty food. That's it.
Thank you very much. We've kind of exceeded our time, so if there are questions, the panelists would be in the audience, and please approach them individually.
A round of applause for our distinguished panel. I request Mr. Rajput to please join us on stage. We'll start with the session moderator, Dr. K.R. Vasudevan. We request her to please step forward. A round of applause for Dr. Vasudevan, Senior Consultant and Head Liver Transplantation, Max Noida. Can we have a more warm round of applause? It's our opportunity to thank our speakers for their time. I now request Padma Shri Dr. Sanjeev Bagai to please step forward. He's Senior Consultant and Chairman, Pediatrician, Nephron Clinic. Thank you, sir. Padma Shri Dr. Soumitra Rawat, Chairman and Head Department of Surgical Gastroenterology and Liver Transplant, Sir Gangaram Hospital. Dr. D. Bhaumik, Professor and Head Department of Nephrology, AIIMS, Ministry of Health and Welfare, Government of India. We also thank Padma Bhushan Dr. S.K. Sareen for joining us virtually, and I now request our panelists to please step forward for a group photograph. Once again, a round of applause for our learned speakers, for our distinguished panel. Thank you very much for joining and sharing your expertise with us. Thank you, Mr. Rajput, for doing the honors. And now we'll quickly prepare our stage for the next session. And post this session, we'll commence with the award distribution ceremony. It's a reminder that the drawing competition winners will be getting trophy in this session, and then certificates and gift hampers will be distributed after post the last session in the evening. So we request all to kindly stay back with us till the last session. We'll be distributing gift hampers and certificates after the last session. And post this session, we'll be distributing trophies. And we now move on to session 9 of the summit, focusing on an extremely relevant concern of our times, the impact of digital exposure on our eye health. And we are all set. It is my privilege to invite the esteemed moderator for this session, Dr. Ritika Sachdev, Director, Center for Sight Hospitals. Can we all together welcome her on stage? A very warm welcome to you, ma'am. Joining Dr. Sachdev on this crucial discussion are our distinguished panel. Please welcome Dr. Brigadier Vijay Mathur, Consultant, Sharp Sight Eye Hospital. Kindly keep the applause going. Dr. Manoj Kumar Yadav, Senior Specialist, Ophthalmology, Atal Bihari Vajpayee Institute of Medical Sciences, and Dr. Ram Manohar Lohia Hospital, Ministry of Health and Family Welfare, Government of India. Very warm welcome to you, sir. Kindly keep the applause going. Dr. Kirti Singh, Director, Professor, Guru Nanak Eye Center, Maulana Azad Medical College, New Delhi. A very hearty welcome to you, ma'am. Professor Padma Shri Dr. Professor A.K. Grover, Chairman, Vision Eye Center and Senior Consultant, Department of Ophthalmology, Sir Gangaram Hospital. A very warm welcome to you, sir. Dr. Anuj Mehta, Professor and HOD, Ophthalmology, VMMC and Safdarjung Hospital, Ministry of Health and Family Welfare, Government of India. Can we once again extend a very warm and energetic welcome to all our esteemed panelists. Thank you for joining us. And now over to Dr. Ritika Sachdev for further proceedings.
Thank you, Asucham, for this forum. In the interest of time, we will be starting immediately. आज का जो टॉपिक है वो है डिजिटल आई स्ट्रेन. इंडिया में 70 करोड़ स्मार्टफोन हैं और 2030 तक 1.2 बिलियन या 120 करोड़ स्मार्टफोन होंगे. इस कमरे में भी बहुत स्मार्टफोन है, तो आई थिंक द कॉज एंड द इफेक्ट इज इन दिस रूम, एंड दिस कॉन्वर्सेशन विल बी फॉर ईच एंड एवरी वन ऑफ यू बिकॉज इट इफेक्ट्स ईच ऑफ अस. तो स्टार्ट करते हैं डॉक्टर ग्रोवर सर. सर, आप ये डिजिटल आई स्ट्रेन क्या है और क्यों होता है, ये ऑडियंस को बताएं.
थैंक यू. तो ये टर्म जो यूज़ की जाती है, डिजिटल आई स्ट्रेन या कंप्यूटर विजन सिंड्रोम, ये दोनों चीज़ें इंटरचेंजेबली सेम टर्म्स हैं. और इनकी इम्पोर्टेंस तब रियलाइज़ हुई जब हम कोविड एपिडेमिक से निकले और हमने देखा कि यूजेज ऑफ स्मार्ट फोन्स एज वेल एज कंप्यूटर स्क्रीन्स इतना बढ़ गया, क्योंकि 3-4 रीज़न से, जैसे हमने एजुकेशन भी उस पर कर दी, कॉन्फ्रेंसेस भी उस पर कर दी, वर्क एट होम आ गया. सो तब रियलाइज़ हुआ कि इसका इम्पैक्ट क्या हो रहा है, और इसकी सिग्निफिकेंस और इम्पोर्टेंस उससे भी पता चली कि जो अब स्टडीज़ आई हैं वो ये शो करती हैं कि सिर्फ ये मैटर हेडेक होने का या आई में ड्राइनेस होने का या स्ट्रेन का नहीं है, शायद कुछ परमानेंट चेंजेस भी हो रहे हैं. इंक्रीजिंग एविडेंस आ रहा है स्पेशली बच्चों में मायोपिया, और हम एक एक्सप्लोसिव मायोपिक क्राइसिस की तरफ जा रहे हैं जहां दुनिया की शायद 50% पॉपुलेशन को माइनस नंबर या नियर साइटेडनेस हो जाएगा. तो ये सब रियलाइजेशन डॉन होने की वजह से अब हम इसकी सिग्निफिकेंस को समझते हैं. अब होता क्या है कंप्यूटर विजन सिंड्रोम में, इसको हम 3 हिस्सों में डिवाइड कर सकते हैं. एक हिस्सा हुआ कि वी हैव ऑक्यूलर सिम्टम्स जो सरफेस पे हैं, जो आँखों में ड्राइनेस क्रिएट होती है क्योंकि हमारी ब्लिंकिंग कम हो जाती है या ब्लिंकिंग कम इफ़ेक्टिव हो जाती है, तो उसकी वजह से हमारी सरफेस ड्राई होने लगती है. और ड्राई आई से रिलेटेड सारे सिम्टम्स जैसे आँखों में जलन होना, चुभन होना, खुजली होना और थकान हो जाना आँखों की, वो सब हो रहा है. दूसरा ग्रुप हुआ जो फोकसिंग मैकेनिज्म से रिलेटेड या अकोमोडेशन जिसको हम कहते हैं, कि आँखों से आप अगर काम करते रहे हैं कुछ टाइम, उसके बाद आपको लगता है कि आपको अब दिखाई नहीं दे रहा, या आपको उससे फोकस नहीं हो रहा, या एक दूर के एरिया पे आप देखना चाह रहे हैं वहाँ पे फोकस नहीं हो पा रहा उस वक्त, तो क्लैरिटी आपकी जो सैक्रिफाइस हो जाती है, वो एक दूसरा ग्रुप है. और तीसरा ग्रुप है जो हमारे इनकरेक्ट पोस्चर के साथ, पोजीशनिंग के साथ रिलेटेड होता है, हमारे नेक स्ट्रेन, हेडेक और थकान, जनरल ओवरऑल फीलिंग ऑफ फैटिग. सो ये 3 ग्रुप ऑफ सिम्टम्स कॉन्स्टिट्यूट करते हैं डिजिटल आई स्ट्रेन या कंप्यूटर विजन सिंड्रोम को. और अभी हमारा ये बहुत एमिनेंट पैनल है जो इसके बारे में और आपको बताएगा कि उसको हम कैसे प्रिवेंट कर सकते हैं, कैसे उसको ट्रीट कर सकते हैं.
थैंक यू सर. डॉक्टर अनुज सर, सर ने बताया कि बच्चों में इसका असर काफ़ी गंभीर है, तो हम डिजिटल आई स्ट्रेन, हाउ इट इज़ इम्पैक्टिंग द चिल्ड्रन, that and what can as parents we do, and what are the guidelines for digital device use in children. आपसे हम ये जानना चाहेंगे.
बच्चों में अभी जैसे सर ने बताया, पोस्ट कोविड या कोविड के टाइम में बच्चे घर में थे, सारा के सारा उनका पढ़ाई सब टैबलेट्स पे या लैपटॉप्स पे हो रहा था, और उससे भी ज़्यादा इम्पॉर्टेंट चीज़ थी कि बच्चों को हम बाहर खेलने नहीं जाने दे रहे थे. उनका आउटडोर एक्टिविटी जो है वो प्रैक्टिकली निल हो गया था उस ड्यूरेशन में, और वो एक कमरे में बंद पास की चीज़ों को ही खाली फोकस कर रहे थे और दूर की चीज़ों को फोकस नहीं कर रहे थे. तो जब हम पास की चीज़ों को फोकस करना होता है तो हमारे आँख की कुछ मसल्स हैं जिनको कॉन्ट्रैक्ट करना पड़ता है या ज़्यादा काम करना पड़ता है, और हम जितनी ज़्यादा देर पास की चीज़ों पे फोकस करेंगे उतनी देर वो मसल्स कॉन्ट्रैक्टेड रहेंगी. अब उनको रिलैक्स कैसे किया जाए? उनको रिलैक्स करने का तरीका है कि हम किसी दूर की चीज़ पे फोकस करके रखें और वो जो मसल है वो रिलैक्स हो. उसके लिए बच्चों में आउटडोर एक्टिविटीज़ को बढ़ाने की ज़रूरत थी. क्योंकि उस पीरियड में वो नहीं हो पाया, तो जैसे सर ने मेंशन किया, उन दिनों में मायोपिया का इंसिडेंस बढ़ गया. क्यों? क्योंकि बच्चों की आँख जो होती है वो प्लायबल होती है, मोल्डेबल होती है. जब वो मसल्स बहुत देर तक कॉन्ट्रैक्टेड रही तो बहुत से बच्चों में शायद उसकी वजह से ये मायोपिया डेवलप होना शुरू हुआ। तो उसमें बच्चों पे ये ज़्यादा असर हुआ। बड़ों की आइज़ जो हैं वो कुछ हद तक एक शेप ले चुकी होती हैं, उनमें इतना ज़्यादा इंसिडेंस नहीं आया। और हमने देखा कोविड के बाद हमारे पास बहुत से बच्चे ये मायोपिया की कंप्लेंट लेके आ रहे हैं। बहुत सी स्टडीज़ हुई हैं, बहुत सारे इसके ऊपर काम हुआ है। 100% श्योरिटी से तो हम नहीं कह सकते, बट ज़्यादातर ऑफ्थेल्मोलॉजिस्ट को ये लग रहा है कि इसका कारण बहुत ज़्यादा नियर वर्क है। अब इसका इलाज क्या है? क्या हम बच्चों को ये चीज़ें यूज़ करने से मना कर दें? बिल्कुल। अभी रिसेंटली कुछ यूरोपियन कंट्रीज़ में ये चल रहा है कि एक एज ग्रुप तक के बच्चों को डिजिटल डिवाइसेस देना बैन कर दीजिए, बट वो इसका सोल्यूशन शायद नहीं है मेरे ओपिनियन में, क्योंकि टेक्नोलॉजी आ रही है, यूज़ होगी, बच्चों को ज़रूरत है। आजकल लेक्चर्स, क्लासेस, बहुत सारी चीज़ें इन डिजिटल डिवाइसेस पे अवेलेबल होती हैं। तो हमें कहीं ना कहीं इसको मॉडरेट करना होगा, एक बैलेंस क्रिएट करना होगा कि अगर बच्चा कुछ घंटे पास के डिवाइस यूज़ कर रहा है, डिजिटल डिवाइस यूज़ कर रहा है, तो उसको कुछ घंटे घर के बाहर जाके आउटडोर एक्टिविटीज़ करनी चाहिए, दूर की चीज़ों पे फोकस करना चाहिए, ताकि जो डिजिटल डिवाइसेस का हार्मफुल इफ़ेक्ट है वो कुछ हद तक नेगेट हो सके।
थैंक यू सर। स्टडीज़ ने एक्चुअली दिखाया है कि 6 से 8 साल के बच्चे आर एट इंक्रीज्ड रिस्क, सो द रिस्क इज स्टार्टिंग यंग। एंड जो डिजिटल डिवाइस में सबसे डेंजरस है वो है स्मार्टफोन, क्योंकि वो आप बहुत पास पकड़ते हैं और उसकी स्क्रीन छोटी होती है। एक्चुअली माई सन आस्क्ड मी फॉर अ हायर रेजोल्यूशन कंप्यूटर एंड आई थॉट इट इज़ अ गेमिंग फैड। पर अगर आपकी स्क्रीन बड़ी और आपकी रेजोल्यूशन बेटर है, so you are not refocusing because of the pixelated screen, so that actually reduces eye strain. So there are technological advances and lifestyle modifications, both that are needed, and please recognize that this risk is starting young. मायोपिया के एपिडेमिक के बाद एक बहुत ही इंपॉर्टेंट चीज़ है जो कंप्यूटर विजन सिंड्रोम कराता है। डॉक्टर कीर्ति मैम, कैन यू प्लीज़ एलैबोरेट ऑन ड्राई आई? ड्राई आई का एपिडेमिक जो डिजिटल आई स्ट्रेन की वजह से बढ़ता जा रहा है।
So, thank you SHSM for having us here on a very important topic. Sorry for the bad throat. Dry eye, again, जैसे अब बात हुई कि जो डिजिटल स्क्रीन है, चाहे वो कंप्यूटर है, चाहे वो लैपटॉप है, चाहे वो स्मार्टफोन है, all these devices grab our attention. जब वो अटेंशन फोकस हो जाएगा तो हमारी जो ब्लिंकिंग है, नॉर्मली एक सिंपल सी परत होती है टियर फिल्म, जिसको बार बार एक लिड जो है नीचे ऊपर करके 12 to 30 मिनट्स टाइम्स अ मिनट इट कीप्स ब्लिंकिंग। अगर आप फोकस इतना करेंगे तो ब्लिंकिंग कम हो जाएगी, सो आपका ड्राई आइज़ का इंसिडेंस बढ़ जाएगा। एंड दिस इज़ मोर इन एरियाज विच आर क्रैम्प्ड, विच हैव अ सिक बिल्डिंग सिंड्रोम, जहाँ पे क्रॉस वेंटिलेशन नहीं है, जहाँ पे एयर कंडीशनिंग है, एंड पीपल आर स्मोकिंग, and especially ladies who are on oral contraceptives or postmenopausal ladies who have hormonal issues and smokers. So, you know, ये जो सारी connection है, it's not only eyes and kidney and liver or heart, it is the whole body. So, आपका बड़ा अच्छा concept है illness to wellness. So, illness of the eyes is linked to illness of the kidney, illness of the liver. अगर आप पानी कम पिएंगे, अगर आप बाहर एक्सरसाइज करने धूप में नहीं जाएंगे, तो आपका डिजिटल स्क्रीन का इम्पैक्ट आँख में ज़्यादा होगा। एज डॉक्टर अनुज जस्ट सेड, बच्चों में बहुत स्टडीज़ हैं कि 40 मिनट अगर रोज़, डॉक्टर बिफोर सेड 30 मिनट्स अ डे अपने आप को दीजिए, 40 मिनट्स अ डे अगर बच्चे को बाहर धूप में, सनशाइन, गोइंग आउटसाइड, बिकॉज सनशाइन में मेलाटोनिन हार्मोन्स, ऑल द एंडोर्फिन्स आर सिक्रीटेड, तो मायोपिया इज़ लेस। आप डिजिटल स्क्रीन्स बंद नहीं कर पाएंगे बच्चों को, वो ज़िद करेंगे, बट अगर उसको आप सोल्यूशन चाहिए तो उनको धूप में स्पोर्ट्स और खेलना सिखाइए, सो दैट इम्पैक्ट ऑफ डिजिटल स्क्रीन टाइम ऑन चिल्ड्रन, इवन इन अडल्ट्स, आपकी जब बाहर कुछ और एक्टिविटी होगी तो आपका इम्पैक्ट ऑफ डिजिटल स्क्रीन टाइम ऑन ड्राई आइज एंड एवरीथिंग विल बी लेस. ऑफ कोर्स हम ब्लिंकिंग ज़्यादा करेंगे, पानी ज़्यादा पिएंगे और लुब्रिकेंट ड्रॉप्स डालेंगे. But as we talked, let's treat the cause. The cause is the poor blinking, the cause is the poor hydration, the cause is the sickness in the body. So I would say, अब एक चीज़ बात हो रही थी, सबसे पहले स्टडी थी पोल्यूशन. व्हेन आई केम इन पोल्यूशन की बात हो रही थी. सो एक तरफ हम कह रहे हैं बाहर पोल्यूटेड हवा है, फिर हम कह रहे हैं बच्चों को बाहर भेजिए. आप बताइए सोल्यूशन क्या है? आई वुड वांट द सोल्यूशन टू कम फ्रॉम हियर. वी हैड दैट मूवी जहाँ पे वो N19 मास्क और ये करके बच्चों को बाहर भेजेंगे. दैट्स गोइंग टू हेल्प. So our solution is to reduce our use of plastic, to reduce our consumptions. We are all such elite people here, so that the air becomes better, the climate becomes better. बच्चों को बाहर जाना, हमें बाहर जाना as adults बहुत ज़रूरी है. अगर हम सब कुछ अंदर कंप्यूटर और उस पर करेंगे, so it's not going to help. So we have to start changing our lifestyle for the dry eyes and for the myopia and for the everything. हम सबको लाइफस्टाइल चेंज करना पड़ेगा, तभी हमारे बच्चे भी हमें फॉलो करेंगे. एंड लास्ट बट नॉट द लीस्ट, देयर इज़ अ न्यू वर्ड इन द ऑक्सफोर्ड डिक्शनरी कॉल्ड एज फबिंग. हैव यू हर्ड ऑफ दैट? स्नबिंग से है फबिंग. And most of us have our phone in hand and we don't look at the people around us. Most of us don't talk to the people around us. So I would say more than myopia, more than dry eyes, what the digital devices are doing is isolating us from our friends, from our fellows, and we are becoming, you know, just attracted to the phone और हम आसपास के लोगों को भूल रहे हैं. And that's one reason why mental health issues are much more in the adolescent children. We are seeing this in our medical college. Thank you.
Thank you, ma'am. So dry eye जो हम लोगों को काफ़ी commonly दिखता है, though environmental factors, if they improve, it will get better. But as a computer user, there are certain tips that we give, including the 20/20 rule and blinking more often. So, ma'am, would you just like to elaborate on the tips for maybe a corporate worker or a student who has to use the device?
So first is drink water. Then the 20/20 is that don't be focused. As I said, blinking कम हो जाती है. So don't be focused for too long on the computer. After every 20 minutes, just take a stretch or yawn or something, take a drink or just blink and look in the distance. So your accommodation relaxes. So about 20 seconds के लिए just blink off. You can have the alarms in or just make it a habit कि हर आधे घंटा 20 मिनट के बाद हमें कंप्यूटर स्क्रीन से हट के कुछ और देखना है. So and that's especially important for the adolescents जिनकी आपकी वो classes चल रही होती है, because there the myopia risk is much more. For the older people, it's the dry eye risk. So the 20/20 rule is just to reduce the duration of the computer usage. And hydration, as I said, is important, and blinking is important. What we talk is something called as think blink. जब सोचो आप blink करो. And especially people who are contact lens users. If they are contact lens users, their blinking वैसे ही कम हो जाती है. So they should just remember कि think blink. One of my doctors used to tell me, आप सांप नहीं हैं, you know, they just to teach. The snakes don't blink, human beings blink, learn to blink.
और मैम ने जैसे ब्लिंक करके दिखाया, वो थिंक ब्लिंक वाला कंप्लीट ब्लिंक इज मोस्ट इम्पॉर्टेंट. पार्शियल ब्लिंक इज नॉट एज इफेक्टिव एज अ कंप्लीट ब्लिंक. हम 14 से 16 टाइम जब ब्लिंक करते हैं पर मिनट, एंड दैट रिड्यूसेस टू 4 to 6 टाइम्स व्हेन यू आर ऑन द स्क्रीन. तो कंप्लीट ब्लिंकिंग ऑन द स्क्रीन, और एक डिवाइस को आप बहुत ऊपर मत रखिए. अगर नीचे रखते हैं तो पार्शियल कवरेज लिड की जो होती है वो इवेपोरेटिव ड्राई आई कम करता है. So that is an important tip, and of course lubricants are available and they are also a measure that some people need. Ma'am ने बहुत अच्छे से बताया कि social isolation is happening. So there are many mental effects of digital devices. So Dr. Manoj sir, ये जो mental और cognitive effects हैं devices के, आप इनके बारे में कुछ elaborate करें please.
Basically जो digital dementia word था, that was derived from this purpose only. It was you just start having forgetfulness, memory loss, and attention disorder, lack of concentration, behavior changes. These all things you see in the dementia. And basically, this term digital dementia was used for this purpose because you don't use your cognitive function and memory function वाला part है वो आप बंद कर use करना कम कर देते हैं because of you open your laptop and you just find the answer. Instead of solving your own by your own brain, you start seeing the all things you see on the laptop on this mobiles. So if you don't use this one, this dementia will start having in those people who use more of this work on the computers in this one.
Thank you, sir. Dr. Vijay, sir, कई लोगों को हल्का सा रिफ्रैक्टिव एरर होता है जो कम पावर होती है. In the context of digital eye strain, minor refractive errors की क्या significance है?
Yes, thank you to the ASSOCHAM for getting us all together. So, I would like to elaborate on this particular aspect. पहले क्या होता था कि जो छोटी छोटी सी रिफ्रैक्टिव एरर्स होती थी -0.25, -0.5, खास तौर से ओनली सिलेंड्रिकल पावर, काफ़ी बार हम ये प्रिस्क्राइब नहीं करते थे कि नहीं ठीक है आपका बहुत कम पावर है, यू कैन डू विदाउट इट. बट जब से हमारे यंगस्टर्स और मिलेनियल्स कंप्यूटर स्क्रीन पे एक दिन में 10 से 14 घंटे बैठ रहे हैं, ये छोटी छोटी रिफ्रैक्टिव पावर्स भी एक बहुत बड़ी समस्या बन जाती है. इसके कारण आँख में आई स्ट्रेन, सर दर्द, फटीगेबिलिटी, डबल विजन, ब्लरिंग ऑफ विजन, ये सब चीज़ें शुरू हो जाती हैं. तो हम इंक्रीजिंगली देख रहे हैं कि यंग प्रोफेशनल्स को हमको बहुत हल्के हल्के से चश्मे के पावर भी देने पड़ रहे हैं. और सबसे अलार्मिंग बात जो हो रही है वो ये पावर बच्चों में यंग एडल्ट एज में आ रही है. 20 to 30 इयर्स के बीच के प्रोफेशनल्स में ये पावर आनी शुरू होती है और ये प्रोग्रेस भी करती है. पहले हम लोग बोलते थे कि 18-19 साल के बाद माइनस पावर प्रोग्रेस नहीं करेगा, मगर आज की तारीख में डिजिटल स्ट्रेन की वजह से ये ट्रू नहीं है. So we are seeing a shift in how myopia was earlier when we were taught and what it is happening, how it is coming up now. और यहाँ पर बहुत बड़ा रोल है हमारा ये डिजिटल स्ट्रेन का. जो भी ऐसे लोगों से मैं पूछता हूँ आप कितने घंटे आप स्क्रीन पे बैठते हैं, 8-10 घंटे से कम तो कोई बोलता ही नहीं है. Everyone is saying in excess of 10 to 14 hours, which includes not only work time but also recreation time. So the same point which panelists earlier and the panelists here are stressing is कि आपको recreation computer screen पे नहीं करना चाहिए. Recreation आप बाहर जाके करिए, आप कोई गेम खेलिए, आप वॉक पे जाइए, आप रन पे जाइए, you play a sport. Please do not sit and watch recreational things on your screen, holding it close to your eyes.
Just to add one thing, what Dr. Mathur has said, the average Indian spends nearly 4.9 hours per day on the mobiles, out of which 3.5 hours he used for social media only, and 40 to 45 minutes for work, and 40 to 45 minutes for gaming. So we should reduce our social timings so that you will be having better, less digital strain and all this.
थैंक यू. आप लोगों ने काफ़ी कॉमनली अब एक ब्लू कट ग्लासेस या ब्लू फिल्टर ग्लासेस के बारे में सुना होगा. ऑप्टिकल इंडस्ट्री में काफ़ी पॉपुलराइज किया है इसको. टू गिव यू अ फैक्ट, द लार्जेस्ट ऑप्टिकल चेन टुडे ऑफ ऑल द ग्लासेस दे सेल, 10% आर ज़ीरो पावर ब्लू कट ग्लासेस. सो जैसे सर ने बताया आपको माइनर एरर है तो ज़रूर चश्मा पहने, पर ब्लू कट ग्लासेस विदाउट एनी पावर, इसमें कितनी साइंस है? डॉक्टर ग्रोवर सर.
Very good question. So the blue cut glasses have become popularized because now the most popular chains are advertising it on TV as well and for lay public very widely. But the fact remains that there is no evidence that they protect against the ill effects, which were the effects promoted were that it, one, decreases the strain, two, harmful effects are prevented, and 3, it promotes more comfortable sleep. So far, a lot of studies have been done. Some experimental studies showed that blue light caused toxicity in the retinas of mice, but those studies are in no way equivalent to the blue light that is coming from the screen of the computers, and not the same quantum, not the same effect, and therefore no harmful effect to human eyes has been shown with blue lights, or even creation of strain is a postulation. And all the studies so far that have been done with blue light protective glasses have not shown any significant effect in preventing any harm, decreasing strain, or in promoting sleep. And all those you can do by a little change in your lifestyle, by doing the other modifications that our panel has been pointing out, using less contrast, using better resolution of the screens, having a matte finish, anti-reflective coatings, and so on and so forth, which can prevent strain and which can prevent any harmful effects due to a screen. So blue light glasses, preventive glasses, at present have no scientific evidence.
Thank you, sir. One question to Dr. Vijay, sir. Sir ने बताया blue light glasses में sleep pattern के studies करी गई हैं. Digital device भी sleep pattern को disturb करता है. So can you elaborate for the audience the relationship between sleep and digital devices?
Again, what we are seeing with the work from home, and a lot of people working from home for companies which are abroad, their sleep patterns are very, very skewed. Most of them are working at night, so which means either they sleep very late, रात को सोते सोते 12:30, 2, 3 बज जाता है, या पूरी रात भर काम करते हैं. So that's a inverse sleep pattern. पूरी रात भर आप जागते हैं और दिन में आप वो स्लीप को कैचअप करने की कोशिश करते हैं. थर्ड थिंग विच वी सी इज अ डिस्टर्ब्ड इंटरप्टेड स्लीप. आपने एक मीटिंग ऑनलाइन अटेंड करी 10 बजे, दूसरी मीटिंग है रात को 1:30 बजे, तीसरी मीटिंग है सुबह 4 बजे. आप इन बिटवीन आप सोने की कोशिश करते हैं. पहली मीटिंग का ख्याल आपके दिमाग में चल रहा है, नेक्स्ट मीटिंग के आने का भी थॉट आपके दिमाग में चल रहा है. सो व्हाट हैपन्स, जो आपको ये स्लीप मिलती है, इट इज़ हाईली डिस्टर्ब्ड, इट इज़ नॉट अ फुलफिलिंग रिफ्रेशिंग स्लीप. जब आपका इन्वर्स स्लीप पैटर्न होता है, आप दिन में सोने की कोशिश करते हैं, एक हमारी बॉडी की नेचुरल सर्केडियन रिदम होती है, उसके हिसाब से हमारे हार्मोन्स बाहर जो सनलाइट और जो डे और नाइट की साइकिल होती है, हमारे बॉडी के हार्मोन्स उसके हिसाब से सिक्रीट होते हैं. उन हार्मोन्स के हिसाब से हमारी स्लीप की डेप्थ इफेक्ट होती है. डे टाइम जब हमारे एनर्जी वाले हार्मोन्स रिलीज होते हैं, हम उस टाइम सोने की कोशिश करते हैं. स्लीप हमारी कभी भी प्रॉपर नहीं होती है, शैलो स्लीप होती है, डिस्टर्ब स्लीप होती है. इंटरप्टेड स्लीप की वजह से जो हमको 7 आवर्स ऑफ प्रॉपर स्लीप मिलनी चाहिए वो नहीं मिलती है. Apart from other effects on the mental health, which again have been brought out, of irritability, lack of concentration, inability to focus and concentrate, memory deficit, eyes के ऊपर भी इसका उतना ही बुरा इफेक्ट होता है. हमारी eyes में dryness, fatigue of muscles which are responsible for focusing. एक हमारी आँख में कुछ ciliary muscles होते हैं जो कि हमें फोकस करने में हेल्प करते हैं, उनका फिटीग. और जब हम काम करना शुरू करते हैं तो बार बार विजन ब्लर होता है, कंप्यूटर स्क्रीन और ये सामने हमें लगता है कि हम प्रॉपरली फोकस नहीं कर पा रहे हैं. इट इज़ ड्यू टू फिटीग ऑफ द मसल्स विच इज़ अ कॉम्बिनेशन ऑफ इफेक्ट ऑफ इम्प्रॉपर स्लीप एंड टू मच ऑफ नियर यूसेज.
Thank you, sir. I would like to request the panelists to just give a take-home message, the summary that you would want the audience to take back. Dr. Anuj, sir.
I'll emphasize that for children especially, the 20-20 rule which was mentioned by Dr. Kirti I'll add 20-22. That means 20 minutes of screen time, 20 seconds of break, and at least 2 hours of outdoor activity per day. That should be recommended for all the children. Again, outdoor activities, now these days, we give children Xboxes and all those things. Those are not the entertainment methods we recommend. So at least 2 hours of outdoor activity should be must for every child.
Dr. Grover, sir.
So this is the digital age and the digital revolution is with us. So अब AI भी आ जाएगा, so the screen time will not lessen. But what we have to take into account is the balance of the whole situation, because it's not just the eye health which has been emphasized so well. It is the total social, spiritual, and of course, the physical aspect of the well-being which needs to be kept in mind. So there has to be a balance somewhere in our lives where we control the digital time to a level which is useful for us, but at the same time does not affect our social relationships, does not affect the mental development or the outgoing nature of the children, confining them to mere activity, and is a holistic picture in mind when we use our screens. Thank you.
Thank you, sir.
My take-home message is you should use 20-20-20 rule with full illumination. Illumination should be very good. Otherwise, 1/3 effect will be decreased. So 20-20-20 in full illumination will serve the purpose. 20 minutes of work, 20 seconds of rest, and then look at it 20 feet distance. Then come back again to work with a full illumination. Don't use in a dim light. If you use a dim light, it has shown some evidence of increasing the IOP. Intraocular pressure increases by 3 to 4 mm of mercury, which has been done in the South Korea. The study was in 2017. So in dim light, it automatically increases. So please use full illumination. That will be my take-home message.
So my message is a request. ASSOCHASM has got this us together, beautiful. You have the power, sirs and madams. We are just telling you what we are seeing. हमारे बच्चे, हम सब के बच्चे 12 से 14 घंटे सबने कह दिया काम करते हैं और वो हमें पता है कि वो गलत है. But their employers are hell-bent on getting them done. Can ASSOCHASM give a message to the government of India that जो laws developed countries में होते हैं वैसे ही laws developing country में भी होने चाहिए, because our children are not indispensable. They are also precious. Why are our children forced to work for 18 hours and then messages check karo and then karo? Because digital is a toxifying thing. So can ASSOCHASM do it? I just want from Dr. Rajput, Mr. Rajput sir. आप एक खाली white paper ही निकाल दीजिए.
Thank you very much. It's a very nice comment. See, most of the companies today are talking about work-life balance.
Yes.
And I know that all the large companies have issued policy notes for their employees. And like I can talk about ITC, the company that I work for, that nobody will send anybody message after 8 o'clock. Nobody will connect with the employees on weekends, so that they have time for their families and for their children. So I think there is a great amount of sensitization amongst the corporate leaders that digital world has actually entered your personal lives, and there is a need to create a balance. So there is already a huge amount of sensitization on this. Large companies are already doing it, and I have no doubt that in times to come, other companies will also follow the suit.
Sir, it is on paper. I am a part of a medical college where at least 20 of my friends have children in big companies. It's not happening, sir. It's not happening in Delhi. I don't know about other Delhis. It's
No.
not happening. Weekends are not given. Time is not given. 4 a.m., 8 a.m. You have to be up by 2 p.m. The 2 a.m. they come home, and no weekends are free, sir. And this doesn't happen in USA or Germany. It happens only in India, sir. It's on paper. Thank
See,
you.
Rome is not built in a day. Any change, it takes time. For people to move from a very leisure life to current days hectic life has also happened over a period of time. And this change from the current over-hectic life to a more balanced life will also take some time. And change is bound to happen because the current generation is much more mobile than perhaps my generation was. So they are not accepting many organizations where they have such regulation, where work-life balance is not maintained. Organizations will have to fall in line. It's just a matter of time.
So my take-home thing would be, firstly, we should all recognize digital eye strain as a lifestyle disease. Just like we have hypertension, diabetes, hypercholesteremia, which are declared lifestyle diseases, digital eye strain should also be declared as a lifestyle disease. Knowledge is the key. Every person who is working on the computer, which is now, I would say, 100%, should be aware of the small things which we have spoken today, and both the employers as well as the employees themselves should be sensitized from time to time to take remedial actions. A yearly eye checkup is, I think, definitely on the cards for all the employees. Thank you.
Thank you, everyone. We started with some figures, so I'd just like to end with figures. 2016 survey in the United States, self-declared computer vision syndrome was there in 65% respondents. Post-COVID, it has increased to 90% respondents. So that is the extent. बच्चों में myopia जो studies में, China में studies हुई थी, COVID के दौरान जो 0.3 diopters per year बढ़ रहा था, वही myopia 1 diopter per year बढ़ा है. So please understand the problem is widespread. It has multi-dimensions to it, and it is causing an increase in myopia at a very young age before children are in control of their discipline. So it is our responsibility as parents and as a society to correct this problem. Thank you all, and thank you, dear panelists.
We thank our learned speakers for a thought-provoking session, requesting Mr. Rajput to please join us for the memento presentation ceremony. We'll start with a session moderator, Dr. Ritika Sachdev, Director, Center for Sight Hospitals. Can we have a round of applause for Dr. Ritika Sachdev? Thank you very much, ma'am. Dr. Brigadier Vijay Mathur, Consultant, Sharp Sight Eye Hospital. Kindly keep the applause going as we now thank Dr. Mathur. Dr. Manoj Kumar Yadav, Senior Specialist, Ophthalmology, Atal Bihari Vajpayee Institute of Medical Sciences, Dr. Ram Manohar Lohia Hospital. Thank you, sir. Dr. Kirti Singh, Director, Professor, Guru Nanak Eye Center, Maulana Azad Medical College. Thank you, ma'am. Padma Shri Dr. Professor A.K. Grover, Chairman, Vision Eye Centers and Senior Consultant, Department of Ophthalmology, Sir Gangaram Hospital. Dr. Anuj Mehta, Professor in HOD, Ophthalmology, BMMC, and Safdarjung Hospital. We request our distinguished panelists to please come together for a group photograph with Mr. Rajput. With this, we conclude this session, and now we will begin a very special segment for today's, which is the award ceremony. We'll be starting it in next 1 minute. We'll quickly prepare our stage for the award ceremony. I request all to kindly remain seated, and once again, I'd like to remind that award ceremony is split into 2 parts. Right now, we'll be presenting trophies to our winners, and certificates and gift hampers will be distributed after the last session today. So we'll request all of you to please be with us throughout the day. We'll be presenting trophies now, and gift hampers and certificates will be presented in the evening after our last session of the summit. Also post the award ceremony, we'll break for lunch. And now we're all set. Ladies and gentlemen, please join me in welcoming on stage our distinguished dignitaries. We are honored to have with us Shri Amit Yadav, IAS, Secretary, Department of Social Justice and Empowerment, Ministry of Social Justice and Empowerment, Government of India. Can we have a thunderous and a louder round of applause for Shri Amit Yadav? A very warm welcome to you, sir. Thank you so much for your gracious presence. Joining him on stage, we have Mr. Anil Rajput, Chairperson, ASSOCHAM National CSR Council. We once again welcome Mr. Rajput on stage. And I'll now request Mr. Anil Rajput to formally welcome Mr. Amit Yadav with a planter. Can we have one more round of applause? Thank you, sir, for your gracious presence. And to begin this segment, I'd now like to invite on the dais Mr. Anil Rajput to deliver his special address.
Good afternoon. First of all, I would like to thank Dr. Fraternity, who have been a tremendous source of strength for us in this program. This is our 3rd edition, and it is done over 2 days. I must acknowledge my sincere thanks once again to them. Today's topics were extremely interesting. I am just sharing this for our chief guest. We discussed in the morning about air pollution, role of AI because things are changing, and how it is going to, in digital era, going to impact us. Then protecting and detoxifier, how kidney diseases are taking place, liver is getting impacted with various things, and dangers of screen time on eye health, which you were partly listening, and all the eminent personalities were here. Creation of healthier generation through the active participation of educationists. That's the session we are going to have a little later. And role of diet and lifestyle going forward is another session that we have today. Illness to wellness journey is about 10 years old. And we started having camps in the city where we will go and do testing of various people, because in this country the biggest problem is that many people don't even go and get a test done, and that test itself can many times create healthier society for our country. what we learned that more than 30 to 40 people were not even aware that they have diabetes or they have blood pressure and so on and so forth, or their heart was under some complication. So with that we started, then COVID pandemic came, and COVID pandemic got us onto the virtual mode, and this community of doctors really helped us to share knowledge and information on the COVID itself, because there was huge amount of misinformation that was going around on the COVID. So during that time we held 93 webinars, shared on different topics, and this fraternity really helped us to sensitize lakhs of people in our country. In fact, I want to mention to honorable guests that in one session we used to have more than 1,000 people joining and participating in those webinars. And then post-COVID, nobody was interested in webinars, and we started this illness to wellness summits. We started celebrating some important days like Heart Day, Liver Day, and these are some of the Diabetes Day. On those days, we kind of get people and sensitize them and make them aware as to what are the do's and don'ts that they need to have. And then we got children to participate in our journey of healthy nation. And I want to share with you that what we've done in the last 2 years, that we have got children engaged in our journey of healthy country. So this year, we have over 12,000 children in over 60 schools who have participated in digital competition, and we gave them 2 broad themes to do these paintings. And one theme was air pollution and its impact on health and environment. And the second theme was importance of health and hygiene. And when you take a round of the paintings that these children have done, they have done amazing job. It's really worth seeing the creativity that these children bring about when they paint. And I want to actually congratulate all the children who have participated this, even though all of them may not be here, but I want to convey my heartfelt thanks to them through the children who are here, that we are really very happy with their participation and contribution, because winning is not something that is the last word in the life. It is participating is the most important thing for you to learn and also achieve greater success in life. So the children who are here, they should carry the message that if somebody has not won the award, there is always a next time. And sometimes, in life, I want to just, in 2 minutes, share one example. Every team, you will know that it is not going to win. Many teams know from the beginning itself, any match you say, whether it's football match, whether it's cricket match, whether it's a hockey match, every match in the teams, you have every team which is the weakest of the tournament. But they give their 100%, and many times you see the upset happening. The weakest team can also make the strongest team lose. So therefore, participation and giving your 100% in life is the most important lesson that you need to carry. So I'm happy to have Shri Amit Yadavji here, Secretary, Department of Social Justice and Empowerment, Government of India. And I'm grateful to him that he has taken time from his busy schedule and be with us at this time. Let's give him a big hand. And I'll request him to share a few words to motivate the children who are here, who will be recognized and awarded by him. Thank you.
Thank you and good afternoon. At the outset, thanks to ASSOCHAM and Shri Anil Rajput for inviting me over for this part of the ASSOCHAM's Illness to Wellness program, the 3rd edition. And I've been honored by the participation. This is the 2nd time I would be, I'm visiting this Illness to Wellness. So I think so, in a way there is a connect. The connect is the children, the large number of children which are participating here are from NDMC schools, and they are, some of them are the winners also. So that is one connect I can think of, and the other connect is our personal relationship which we have. But more important is, I think so, it's such a wonderful forum which has been built, where we saw a large number of one of the leading eye experts here just before this session, and they're giving their views and they're giving pointers and the last messaging very, very significant. And I think so the other sessions also are as enriching, with the kind of high level of participation of the doctors. And on the other side is, as I see, a large number of children are there. They are the one who are, to this message is largely there, beside everyone, for all of us. And I think so, this is not the objective is putting these sessions on media where people can benefit out of it, would be something so that it has a far wider reach. We all know, and I think so it's not something unique which I'm saying, but it's definitely the preventive work on the illness is the best thing, and it starts at an early age. And if we can, through various media, through various measures, ensure that this learning on good health, hygiene, simple act like cleaning washing your hands, and how it can impact your health throughout your lifetime. Simple act like brushing your teeth and keeping them clean, how it impacts your health throughout your lifetime. And these are some messages which has to go at a very young age. And the 2 topics which were put up today, which are part of that painting, are very, very relevant. One is obviously the health and hygiene, and the other is air pollution. All of us are getting affected by the pollution. And it's not immediately measurable, in the sense it's not immediately measurable. It affects us in the long run. It affects individual, it affects family, it affects society, and it affects the nation. The nation also has to bear the cost of sick and people with various challenges, health-related challenges. It brings down the national economy. It brings down the impact on the infrastructure, health infrastructure, which we have to bear, and so on and so forth. So I think so, very good, as Mr. Rajput said, it's been going on for last 10 years, but now they put it in a illness to wellness kind of and a systemic way. So I think so that this is something which needs a bigger forum, bigger interaction, and to grow. And my best wishes on this, the ASSOCHAM and the ASSOCHAM reaching out to a wider audience. I'm told more than 12,000 students participated. That is one way of reaching out. And I think so the messages has to go to the schools, the children, and through the teachers. And one important point which was there, which was someone said when I was attending the last session briefly, was annual health checkup. And I think so that makes a difference. And it should start early, so that we can measure it, the changes annually which is happening on those health indicators, whether it's a child or whether it's a youth or whether it's a middle-aged person or it's an old-age person. All of us need that kind of thing, so that we can contribute to ourselves. We have a physical and mental well-being, and at the same time, there is a lot of costs involved if we have to seek health. It's not easy, and it has a financial drain on families, especially with large number of our population not being covered under any health insurance scheme. The government has obviously now come out with the PMJ, which is the Ayushman card. A large number of families would be getting covered, but still large numbers to fall outside that. So thank you so much, and I think so. I would conclude by saying that what is a old age adage, which is health is wealth. Thank you so much.
Thank you very much, sir, for your words of wisdom. We'll now showcase a brief video highlighting the drawing competition that took place. I now request the dignitaries to please step forward for the award presentation, to kindly step forward. And now, ladies and gentlemen, we'll begin the much awaited award ceremony. Today we'll be felicitating the category B students, which is grade 6 to grade 8. And we'll start with the first theme, which is air pollution and its impact on health and environment. We'll begin with the special mentions. And the first special mention prize goes to Arvia Abrar Shah, Government Sarvodaya Kanya Vidyalaya, Bulbuli Khana. You can come now. Otherwise, I request the awardees to please enter from my left and exit from my right. So you enter from there and you exit from here. The next special mention winner is Tanish Kumar from Atal Adarsh Vidyalaya, Lodi Estate. Please give it up for Tanish Kumar. Tanish, quickly come to the stage. Many, many congratulations, Tanish. Our next special mention goes to Aira Khan from Elcon Public School, Mayur Vihar. Aira, please wait. Please give it up for Aira Khan from Elcon Public School, Mayur Vihar. Up next, I invite Rick Maji from Atal Adarsh Vidyalaya, Ansari Nagar for the special mention. Rick Maji. We have 3 more special mentions after this. Kindly keep the applause going. I once again request the awardees to please enter from my left and exit from my right for a smooth coordination. Let's encourage all the children who are coming on stage with our claps. Up next, I invite Avneet Kaur from Atal Adarsh Vidyalaya, Dr. APJ Abdul Kalam Lane. Please give it up for Avneet Kaur. Our next special mention prize winner is Arna Garg from Elcon Public School, Mayur Vihar. Congratulations. And the last special mention for this team goes to Sanvi Sahu from St. Xavier's High School, Gurgaon. Many congratulations to all these special mention prize winners. Kindly keep the applause going. And I'll now announce the third position holder for category B, which is grade 6 to 8, for the theme air pollution and its impact on health and environment. And the third position holder is Khushi Kumari from Atal Adarsh Vidyalaya, Ansari Nagar. Can we have a louder round of applause for Khushi Kumari? Khushi, quickly come to the stage. Kindly keep the applause going for Khushi Kumari from Atal Adarsh Vidyalaya, Ansari Nagar. I would request all the awardees to please stay back, as we'll have a group photograph towards the end of the ceremony. And now I'll announce the second position holder is Shereyar from Navyug School, Mandir Marg. Please give it up for Shereyar. Let's all encourage these young champions with our applause. Let's keep the energy going. It's a moment of great pride for them, their families, their teachers. So let's be a part of this celebration. And now it's time to announce the winner, that is the first position holder. And it goes to Sonali Pradhan from Atal Adarsh Bengali Balika Vidyalaya, Gol Market. Can we have the loudest round of applause for the winner of the theme air pollution and its impact on health and environment for category B, and it is Sonali Pradhan from Atal Adarsh Bengali Balika Vidyalaya, Gol Market. Please give it up for Sonali Pradhan. There we have the proud teachers also joining in. And now we move forward to the second theme, which is importance of health and hygiene for category B, which is grade 6 to 8. We'll start with the special mention prizes. And the first special mention in this category goes to Supriya Das from Navyug School, Lodi Road. Please give it up for Supriya Das for the theme importance of health and hygiene. Are the people sitting on the back applauding, cheering for our young champs? The next special mention prize goes to Kainath Khan from Atal Adarsh Vidyalaya, Dr. APJ Abdul Kalam Lane. Please give it up for Kainath Khan. Few more awards to go, so let's keep the momentum going. We have a hearty lunch prepared for all of you, so your energy is not going anywhere. We will refuel it very soon. Next special mention goes to Janvi from Atal Adarsh Vidyalaya, Kidwai Nagar. Congratulations to Janvi. There are two more special mention, and then we'll start with the third position holder. Let's all congratulate Janvi. And now I'll invite the next special mention prize winner, and it goes to Lalita from Sarvodaya Kanya Vidyalaya, Madipur. Congratulations. And now I'll announce the last special mention for the theme Importance of Health and Hygiene, and it goes to Yamini Purohit from Navyug School, Sarojini Nagar. Please put your hands together for Yamini Purohit from Navyug School, Sarojini Nagar. We have Yamini on stage. It's a moment of pride for parents, for the student, for the entire school, the entire clan. So let's all congratulate them and be a part of their celebration. They have worked very hard to receive this prestigious award. Congratulations. And now it's time to announce the third position holder for the theme Importance of Health and Hygiene, and it goes to Drishti Chauhan from ASN Senior Secondary School, Mayur Vihar. Please give it up for Drishti Chauhan, everyone. Let's keep the applause going. Let's all keep cheering and applauding these young champs. Let's encourage them to do even better in future. Congratulations, Drishti. And now it's time to announce the second position holder. And the second prize goes to Neha Verma from Navyug School, Vinay Marg. Let's all congratulate Neha Verma. We have the teachers receiving it on behalf of Neha. As you can see right now, we are felicitating the students with only trophy. We'll be presenting gift hampers and certificates in the evening. So make sure that you stay with us till the end of the day. And now it's time to announce the winner of the theme Importance of Health and Hygiene. And the first position holder is Ananya from Atal Adarsh Vidyalaya, Dr. APJ Abdul Kalam Lane. Can we have the loudest cheer for Ananya? She is the winner in category B for Importance of Health and Hygiene. Can we have a louder round of applause? Let's have some energy in the house. Many, many congratulations, Ananya. We have few more awards to go. We'll now be awarding schools for maximum participation. And the second runner-up school with maximum participation is Meera Model School, Janakpuri. Please give it up for Meera Model School. The second runner-up for school with maximum participation. And we have teachers from Meera Model receiving this prestigious award. Kindly keep it going. I'll now invite the first runner-up, which is Alcon International School, Mayur Vihar. Congratulations, Alcon International School, Mayur Vihar. We have teacher from Alcon? Any student can also receive from Alcon. We do have students from Alcon. Alcon, Mayur Vihar. Students quickly come and receive the award, trophy. And now I'll announce the name of the school with the maximum participation. Congratulations, Alcon. And now the first position holder, a school with the maximum participation is St. Xavier's High School, Gurugram. Please give it up for St. Xavier's High School, Gurugram. We'll also have a group photograph with our dignitaries on stage, so please be with us. Also, ladies and gentlemen, there is one more award which I have to announce, which is from category A, which took place yesterday. That is from grade 3rd to 5th for the theme Air Pollution and its Impact on Health. It is a special mention award and it goes to Arshika Mishra from Bluebell School International, Kailash Colony. The category A prize distribution took place yesterday. So we have Arshika Mishra receiving it today from Bluebells under the special mention category. Before I invite our awardees for a group photograph, I would request Mr. Rajput to present a token of gratitude, a token of respect to Shri Amit Yadav. Can we have the memento, please? And then we'll have a group photograph. Meanwhile, I would request the awardees to please come on stage with your trophies. Do bring your trophies along. We'll have a group photograph with the dignitaries. All the awardees, please bring your trophies. Quickly come on the stage as we are now getting a little late for our lunch. So quickly come on the stage. Let's have a group photograph and then we'll proceed for lunch. The lunch will take place at the same venue as yesterday, which is Desire Hall. So once you exit from this hall, you have to take a left and then one more left and you'll find Desire Hall on your right. I'll explain the directions of Desire once again. Once you exit from this hall, you have to take a left, then one more left, and the Desire Hall is on your right. And we'll take a 30 minutes lunch break and we'll resume with the sessions at 2:45 p.m. in this very hall. Post-lunch session will start at 2:45 p.m. in this very hall, and the lunch is in Desire. Once again, many, many, many congratulations to Category B winners. You've made us all proud, and we wish you all the very best for your future endeavors as well. We hope to see you all in our future award ceremonies as well. I would request the students to collect the trophy boxes. There is a counter that has been set up on my left. You can collect your trophy boxes from there. A desk has been set up on my left. You can collect the trophy boxes from there. And once again, reminding that we'll be distributing gift hampers and certificates after the last session today, so please be with us.